Meantime, a temporary hospital at the Austin Convention Center is now treating its first patient. KVUE's Molly Oak is live outside the convention center with the story. Molly?
And remember, Terry, that field hospital, which is really the convention center, opened up yesterday. As of this morning, no patients had been transferred, but as of 4:30, we learned the first patient had been transferred and more patient charts are being reviewed for possible admittance. Now, the whole point of this field hospital is to relieve stress on hospitals and ICUs. And Dr. Mark Escott has been warning that projections show ICUs will hit capacity tomorrow. Escott referenced projections from the UT COVID-19 Modeling Consortium. You're looking at its projections for ICUs in the Austin area from this morning. Escott says the median projection, that's that blue line you see in the corner, shows us hitting the 200-person threshold. As of this morning, tomorrow's projection is 203 patients.
As the hospitals become more overcrowded and the ICU space dwindles to zero, that's when we talk about things like the crisis standards of care, having to triage who gets that treatment and who doesn't. We do not want to face that situation here.
So if you've been listening whenever Dr. Mark Escott gives an update, you probably keep hearing about this 200 beds number. Well, Escott says that's the max they can anticipate for COVID, because he says while there are more than 200 ICU beds in the Austin area, he says there's needed for other things and are full. He says hospitals don't normally operate at a capacity where there's a lot of extra space. Now, of course, we've talked about hospitalizations when we're talking about COVID. We can't talk about COVID without talking about vaccines. Today, Austin Public Health also launched their vaccination registration site. That's for the vaccines that APH receives.